Hi everyone, this is Harsh Nagpal and I'm your host for today's podcast. In today's podcast, we have Dr. Avinash TS, who is a lead consultant in the Department of Urology at Aster CMI, Bengaluru. Dr. Avinash specializes in minimally invasive urology. Thank you so much, Doctor, for joining us in today's podcast and spending your valuable time with us.
Hi Harsh, thank you for having me here.
So, Doctor, India is usually looked at as a very young and a youth country. But what we also need to keep in mind is that nearly 12% of India's total population is the elderly. And we also have stats that are coming in that state that almost 50% of India's total men come up with this issue known as prostate enlargement, as in when they are touching their 50s or maybe later 50s. So, one major issue with men that we notice is they don't really talk about things easily, especially when it comes to such issues. They are a little silent, which also leads to them not taking medical help, not taking medical assistance. So, today's podcast aim is very simple. We are going to be talking about things that men should know before it is too late. What do you have to say about this, doctor?
Many patients above 50 years of age they have prostate enlargement, and as rightly mentioned, at the age of 60 years, when you look at the average, nearly 50% of the patients will have prostate enlargement, and in that majority will have symptoms of urinary symptoms. And if you go further, at the age of 85 years, nearly 90% of the patients will have prostate enlargement. So, majority of these men, elderly men, come with prostate issues.
And I think one thing about men that we notice is we don't really like talking about our problems. We kind of, sideline our problems. So that is one more major issue that you have noticed, that men are not very open in talking about issues like this.
Yeah, it's true. But off late, the awareness is definitely better compared to like a decade ago. Particularly in urban areas, people are much more aware of these their urinary symptoms, and they do seek advice.
I'm glad to see the trends changing. So, doctor, our major goal out of this podcast is to get to know a little bit more about the symptoms and what can be done. And before it's too late, how could we figure out to deal with the prostate enlargement? We have a few questions that we have comprised, which would help us in talks with you to deal with prostate enlargement. So, could we proceed,
Yeah,
doctor?
sure.
So, my very first question is that what are the most common symptoms that people walk into your OPD with? And is it true that most of the men come to you only when it is, the problem is very unbearable?
See, as a urologist, we see like spectrum of diseases in our OPD, like prostate problems, stone issues, and all those many other problems. And as you rightly mentioned, it is the mainly urinary symptoms like weak urinary stream, increased frequency of urination, that is frequent trips to bathroom, urgency, and urine incontinence, that is lack of urine control. So these are the common symptoms with which the patient come to our OPD, and majority of these, particularly men, they got a prostate enlargement.
Okay, so as you said that most of these symptoms clearly mean a prostate enlargement, or could there be other issues as well?
Yeah, definitely. I mean, there are different diseases which can lead to these kind of symptoms. But when you're talking about elderly, like above 50, 60 years of age, the majority of these symptoms are attributed to prostate enlargement.
So, doctor, moving on to the next question, what are some of the early warning signs that men usually ignore and shouldn't be? And also, what is the age group that you usually notice who walk into your OPD with the prostate enlargement issue?
The common symptoms of prostate enlargement are frequent trips to the washroom, and feeling urgency to pass urine, and weak stream, and interrupted urine stream. And after passing urine, they will not be satisfied. They feel that some amount of urine is still remaining inside. And sometimes, if there is an infection, they will also feel a burning sensation while passing urine. These are the common symptoms with which prostate uh, patients present to our OPD. And the common age group is it generally starts after fifth decade. So commonly seen like sixth or seventh decade, but sometimes we see early 50s also patients come with these symptoms.
Understood, doctor. So, usually, I think maybe early 50s onwards,
Yes, yes.
nothing below that? Or
Very,
is it
very, very
rare?
unlikely, but unless there is a strong family history, because there is genetic predisposition. If the somebody in the family like father, brother has a prostate enlargement, so that younger brother can have these symptoms early in life. I mean to say maybe early 40s or late 40s also they can have symptoms.
Okay, now that you mentioned that it could be hereditary as well, what are some of the reasons or some of the causes for prostate enlargement? Or I think in medical terms we call it BPH,
Yes,
right?
yes.
So is it something that is lifestyle focused, or is it hereditary or genetic, or how is it like, doctor?
As you said, medical terminology used is BPH. It's benign prostatic hyperplasia. So I want to very clear to our audience that it is a non-cancerous enlargement of the prostate. Okay, it is quite common. Nearly 90% of the prostate enlargement are there non-cancerous. So many people think once prostate is enlarged, it is cancerous. That's not true. That's myth actually. And now coming to the causes for this non-cancerous enlargement, that is BPH, the single most important risk factor is age. So as a man get older, the size also increases. Okay, so I mean to say, like, as a percentage was I mentioned you, at the age of 60 years, 50% of the men will have prostate enlargement, and at the age of 85 years, 90% will have prostate enlargement. So as you get old, the prostate also increases. The reason why it enlarges as the age increases, it's not clearly known, but all experts agree that it is mainly related to some hormonal changes in the body. Okay, that's the one thing. And second thing is, you asked about hereditary predisposition. So definitely, it is BPH is hereditary. There is a strong genetic predisposition, and if somebody in the family, like father and brother, has elder brother has this disease, then definitely the younger brother is going to have this prostate enlargement early, relatively early in his life, maybe like late 40s or early 50s. And these are the main things. One is age, second one is genetic predisposition. A third thing is, you asked about lifestyle, this thing, lifestyle, this hypertension and smoking. So this has got a strong correlation with prostate enlargement. And apart from that, obesity, that overweight and diabetes and lack of exercise, lack of healthy lifestyle also can predispose to this prostate enlargement and subsequent problems.
So, doctor, I was reading that modernization and urban lifestyle is one more major reason for observation of prostate enlargement. Is this true?
Yeah, it's true. So it has got modernization, like or modern lifestyle has got two implications on prostate enlargement. One is age, because with increased, improved health services, the longevity, the lifespan of men is increasing in India, definitely. So as I mentioned, age is a one risk factor. So when you find more and more elderly people, definitely they're going to have a prostate enlargement. That's one correlation. And second thing is, because of these modern lifestyle changes, basically Western lifestyle changes, life is becoming more and more sedentary, and lack of exercise, excessive weight gain, and metabolic syndromes like diabetes, hypertension, smoking, all these things contribute to prostate enlargement. Newer lifestyle, the modern lifestyle is adding to the problem.
All right, doctor. So, do you feel this is only a city problem, or do you notice it even in the rural households?
Prostate enlargement is, it should be common to all men, but these modifiable risk factors, they're more common in urban areas compared to the rural areas. Rural areas, the other problem what we come across is, they don't seek medical help early. They feel it, like, suppose if somebody is getting up 4 or 5 times in the night, he feels like it is quite natural with his age. As he gets older, that is natural to get up so many times in the night. Actually, that is not. That's basically a underlying prostate problem, but he doesn't seek the help. That lack of awareness in the rural areas is a problem, whereas in urban areas they are aware of these things, but the lifestyle is adding to the problem.
So, you say, I mean, their urban or their city background has nothing to do. It is.
It is nothing to do, but generally, what I mean, that is our assumption, is that the rural areas is quite, the people are quite active, and they follow generally healthy lifestyle. That's our assumption. That's why these modifiable risk factors are not much in rural areas. It's more in urban areas. But other negative factor which affects them in rural areas is, they don't seek medical help early. They come, yeah, they come at very late stage.
Okay,
So that is a
understood.
problem.
Doctor, have you noticed that there is an uptrend in the cases with the years, or?
There are many factors which are contributing to this increasing number of cases. One is this lifestyle, and second thing is, the I mean, awareness is improving, so people are getting these health checks every year more often. So they come to know there is a prostate enlargement, or there is rise in the PSA, or there is infection. So for all these reasons, they do come to a specialist. to seek a help. So that's why the definitely numbers are going up.
So, doctor, moving ahead, at what stage do you usually recommend the procedure for treating the prostate enlargement?
See, prostate enlargement, I mean, basically, we're talking about this non cancerous enlargement, which is BPH. So, in that case, when patient comes to us with his, all the urinary symptoms, which I mentioned, like variety of symptoms, we do run couple of tests like urine test, blood test, and ultrasound scanning, uroflowmetry to assess the severity of the problem. And once we understand what is the extent of the problem, then we will start treating. So the first line of treatment for BPH is medical management. That's medicines. So there are very good medicines available for BPH, which will help them in passing urine and reducing their symptoms. And there are medicines to halt the further progression of the enlargement. So it's a combination of two medicines which we generally advise depending on the size of the prostate. And the next step is surgery. Surgery is required when patient they don't respond well to medicines. There will be a set of patients who don't respond to the medicines. That's the one scenario where we suggest a surgery. And second scenario is patient has already developed some complications when they come to us because of this prostate enlargement. Like complications means if he's having repeated urinary tract infection, if he's passing blood in the urine, if he has developed any stones in the bladder, or if he's retaining a lot of urine in the bladder, which is affecting his kidney health. So these are the some indications where we don't wait by giving medicines. We suggest the surgery. These are the treatment options. One is medical management, other one is surgical management.
Understood, doctor. And at what phase or what stage does the HOLEP come in?
See, HOLEP is like it's a holmium, a short form of holmium enucleation of the prostate. It is basically a endoscopic, minimally invasive surgery which uses a laser, holmium laser, to remove the prostate. So, minimally invasive in the sense we are using a natural orifice. Natural orifice is that the urethra through which the urine flows. Through that orifice, we are passing a endoscope and removing the prostate. So there will not be any cut or a stitch on the body. It's a completely scarless endoscopic laser procedure. And as I mentioned, laser is used to remove the prostate by a technique, a special technique. And since it is like we are using laser, the chances of bleeding and all those things are less.
Understood, doctor. But going forward, when a patient hears the word procedure or surgery, I mean, usually every human has this fear the minute they hear a procedure or a surgery. Do you face this issue as well with your patients? Do you see them having, being a little fearful and going ahead with the procedure? Or what are some of the common fears that they would be facing?
Definitely, I mean, any patients, if you once you tell the surgery is required, definitely they will have their own apprehensions, and they would like to know more about these procedures from the doctor. And sometimes when they before they come to us, they must have heard about these procedures. Some relative, some friend must have told about this, and there are some like issues, like in the sense like all procedures has got some inherent complications. Okay, it doesn't mean that everybody will have those things. Coming to this whole procedure, the common apprehension the patients generally have is they many people think after surgery they have to carry a bag or a tube. It's a lifelong. I mean, many people come and ask, do I have to carry any tube or a bag after this surgery, or do I have to wear a diaper because I will lose a control over my urination? These are the two strong apprehensions they generally have. That is not true, actually. That's a myth, actually. uh, Thing is, they think that after surgery they're going to lose that urine control. That's why they need to have that tube or a diaper. So after this surgery, sometimes there will be a lack of urine control. We call it urine incontinence. That is a transient. It's like a temporary thing, and it doesn't happen to everyone. Maybe out of 100 patients, maybe 5 to 7% will have that temporary incontinence, which will get better over a period of time. So they don't have to carry any tube. They don't have to wear a diaper.
I'm glad you cleared the myth for us. So, doctor, before I came to this podcast, I was reading one of your blogs, which was also speaking about HOLEP being a very safe procedure. For someone listening to this podcast, how would you like to let them know more about HOLEP?
So as I mentioned, HOLEP is like it's a basically a minimally invasive laser procedure. where we are going to pass endoscope through the urine passage, natural passage, and we are going to completely enucleate. Almost 80-90% of the prostate will be removed with a special technique, and those prostate tissue will be removed. After that, there will be a catheter. Catheter means that is a tube which drains the bladder, that drains the urine from the bladder. So that will be kept for generally for 2 days. Very rarely we keep it for a little longer. And after 2 days, we'll remove that tube, and then patient will be discharged. So next day itself, patient will start walking. There are no restricted mobilities, and he can have his normal food and all those things. After going home, also he can do all his routine activities. So I said there is no restriction in any kind of activities. Only we what we recommend is to avoid any kind of long distance travel for a couple of weeks, or avoid two wheeler riding, and they should avoid constipation, all these things, because these factors can lead to sometimes blood in the urine. So to avoid that, we recommend that. Otherwise, no restriction to any kind of activities. He can go for a walk, he can go for a jog, he can join a gym. So it is very fast recovery, since it is a minimally invasive surgery. The recovery is quite fast. So they need to be in the hospital for 2 or 3 days. That's all.
So one of the major advantages that I noticed about HOLEP is that life is back on track very soon. There's not much holding you back. Everything seems normal after it. Any other advantages that you notice compared to a traditional procedure
Yeah, I
in
mean,
HOLEP?
yes, yes, definitely. So since we are using laser, the chance of bleeding is quite less compared to the conventional surgery. The bleeding is less, and the time required to do the procedure, that is to remove the prostate, is also quite short compared to the conventional surgery. And third advantage is the durability of the surgery. I mean to say, suppose if somebody has got 100-gram prostate, so with a laser technique, we can remove majority of this prostate tissue. So the chance of this prostate growing again, like growing back, the recurrence of this prostate disease is very very less. That means this surgery is going to last for very long. Conventional surgery, sometimes after a few years again the prostate can grow and can cause an issues. So main major advantages are less bleeding, shorter duration of surgery and shorter hospital stay, and a durability of the surgery, long lasting.
Thank you so much for the in-depth answer, doctor. Actually, it also answers my next question. My next question was how soon do patients get back to normal life? But I think, as you rightly said, maybe 2 or 3 days after HOLEP. Right. Okay. So that's very relieving to hear. And my next question would be, is there a stage where patients reach in such a phase that this problem becomes irreversible just because they pushed it for very long time?
Yeah, that's true actually. Many patients who ignore these early symptoms, what I mentioned earlier. So what happens is the bladder is working against the resistance. It's a prostate is sitting like a block, and the bladder has to work extra to push the urine out. So if they don't seek medical attention soon, what happens is over a period of time the bladder becomes weak. So we call it as hypotonic bladder. So once the bladder is weak, urine is going to remain in the bladder. To pass urine, normally two things are required. One, the passage should be clear, there should not be any obstruction to the urine flow, and there should be adequate strength in the bladder to push the urine out. Once the bladder is weak, since it already there is a resistance to the urine flow, the urine will accumulate in the bladder. So that urine accumulation in the bladder can have multiple implications, multiple consequences. One is like patient can have repeated infection, which is difficult to treat in presence of prostate enlargement, and that retention of urine can put pressure on the kidneys. Okay, we call it as obstructive uropathy, where the renal function becomes a problem. The kidneys starts getting damaged. So, and third thing is sometimes they will form stones in the bladder. So this is a kind of bladder becoming a weak, and putting a pressure on the kidney is a kind of little serious concern, and sometimes it can be irreversible problem.
And it also leads to
So
other
even,
problems, as you're
yeah,
saying.
even after
Hmm.
surgery, the bladder may not get back to its normal status. That's why we call it as irreversible.
So even though they came in, but because they were late, it becomes irreversible even after the procedure.
Yes.
So if you had to point out one common mistake that causes this maximum long-term impact or damage, but people don't realize it at that time, what would that be?
Again, same thing. It is like assuming that getting up 4 or 5 times a night is a normal thing. Uh, According to his age, it's a wrong thing. I mean, whenever there is notice unusual or a worrying symptom, immediately they should seek medical attention, instead of assuming, okay, it's quite natural for his age, or it's quite natural for this weather. uh, they are the wrong things.
Going ahead, doctor, what are three simple uh, tricks or three simple things that all we men could follow that could help us in taking care of our urinary and prostate health?
One is, I mean, somebody is smoking, quit smoking. If somebody is taking too much of alcohol, they have to reduce it. Even though there is data, scientific data, like moderate intake, I mean, that's difficult to quantify what is that moderate intake, have benefit over prostate. But too much of alcohol can cause it. And maintain ideal weight, reduce the obesity. And if you have diabetes and hypertension, take care of it, and it should be under proper control. And most important thing is regular exercise. Regular exercise, it has got direct effect on the prostate, and it affects all these problems, like it will help you in reducing the weight, it will help you in controlling hypertension, it will help you in controlling diabetes. So regular exercise, cut down the weight, and stop smoking, alcohol intake, these things.
Understood, doctor. Now that you told me about these three important factors, consider Mr. X is diagnosed with prostate enlargement and he's overweight. Maybe he's 85, 90 kgs, whatever. He's over his weight. He's not in his ideal BMI. And considering without taking any, procedure or without taking any medication, he gets back on track, quits smoking, quits drinking, make sure he's losing weight and everything is back on track. He's somehow fixed his lifestyle. Everything is good to go. Do you feel that this prostate enlargement also could then be controlled naturally?
The thing is, once prostate is enlarged, we can't reduce the size of the prostate. Okay. Suppose if that person had followed this healthy lifestyle from beginning only, probably would have avoided prostate enlargement. Now it is enlarged, it's enlarged. We can't reduce just by reducing the weight, or just by quitting the smoking. But definitely there is an advantage of taking control of his life, in the sense, if he reduces weight, if stop smoking, alcohol intake, and controls diabetes and blood pressure, definitely these factors have got effect on symptoms. See, there are two aspects. One is the effect of these things on the prostate enlargement as such, the morphology of the prostate, where prostate becomes big. That's one part. Second part is effect of these factors on the symptoms. If, for example, if somebody has got a prostate enlargement, 50 grams of prostate, and if he has got a lot of symptoms like uh, frequent trips to bathroom, and urgency, and very weak stream. So suppose if that person has an uncontrolled diabetes, or if he has a overweight, or if he's smoking a lot, these symptoms will get aggravated. Minus those factors, like minus obesity, minus diabetes, minus smoking, the symptoms will be much less. I'm making myself clear. So
Understood,
one
doctor.
one is the effect of these factors in the prostate enlargement, which once it happens, it cannot be reversed just
Hmm.
because you're losing weight. But definitely it is going to help you in reducing the symptoms. Basically, see, I mean,
Reducing the impact,
what
maybe.
matters to the
Hmm.
patient is
Hmm.
symptoms. It is not the ultrasound report which says 50 grams, 100 grams, 200 prostate. It is the symptom which I mean, which is bothering to the patient. So those symptoms can be reduced with these lifestyle changes.
So the harm that is done previously is
It
done.
is enlarged. We
Hmm.
can't reduce the size of the prostate, but
The
following,
symptoms can be
yeah,
controlled.
this, yes, symptoms can be controlled, and probably he can be managed only with medicines, may not require surgery.
Procedure.
And
Okay. Hmm.
they do, I mean, patient without these factors, they do respond well to treatment, any kind of treatment, either a medicine or a surgery. They do respond very well without these additional factors.
Understood. So it's a good thing if he's changing his mind to
Yeah,
fix his
definitely,
lifestyle.
he should.
The harm is done is done. He will, maybe, the procedure comes down or the medication intake comes down. That's it. But he will still have to consult a doctor. He'll
Yes,
still have to go
yes,
through a medical support.
definitely. So that is the advice. I mean, from beginning only, you adopt that healthy lifestyle, so that it is not just a prostate, it's a overall health. So it will negate that impact on all other organs in the body, be it a prostate, heart, liver, lung, kidneys. So it's good for everything, healthy lifestyle.
So now that leads me to my next question, doctor. How often should a healthy man, a man who's not facing any symptoms much, who's been following a good lifestyle, but he's touching his 40s or say maybe early 50s, how often should he consult a doctor or get himself checked?
With regards to this prostate enlargement, generally, I mean, generally it is seen like after 50 years of age. What we recommend is like once in a year, once in a 2 years, they should get themselves checked. General health checkup is routinely happening. Along with that, specific to the prostate, like on the ultrasound scan to see whether prostate is enlarged, and there is something called as serum PSA, prostate specific antigen, which is specific to the prostate cancer. So that we recommend maybe once in a year or once in 2 years. But the people like a men with a strong family history of any prostate cancer, so for them it is little early, maybe around 45 years of age, we recommend like yearly screening for a prostate cancer. For a BPH screening, it is just maybe an ultrasound scan, and if they got any symptoms, they should seek a help. But if they got a strong family history of prostate cancer in a family, like father, brother, or somebody, the stringent, I mean, it's very stringent screening, because once in a year, once in 2 years, they have to get a serum PSA and checked by a urologist.
Even if they're not
So,
seeing symptoms.
yeah, yeah.
Okay.
Sometimes prostate cancer can be a very silent thing,
Mm.
did not cause
Mm.
symptoms.
Anything for men below 40 to worry about?
No, generally no, unless they have symptoms. If they have symptoms, definitely they have to seek an advice. Generally, I mean, less than 50 years of age, when they come with urinary symptoms, uh, not all patients will have prostate enlargement. There are other issues, like sometimes it's urinary tract infection, or it's a stone disease, or we call it a stricture urethra, where there is a narrowing of the urinary passage. So those also can cause similar kind of symptoms. So once he gets evaluated by a specialist urologist, so we'll come to know why he's having these problems. Then we can treat accordingly.
Very nice. So all of your patients have walked out very happily after Hollywood.
Yeah, definitely.
Very nice. So now that we've understood how common and how alarming prostate enlargement is, doctor, in this particular segment, I mean, in prostate enlargement, do we notice any emergency situations, emergency conditions?
Yeah, definitely. Some patients who ignore their warning symptoms, urinary symptoms, can suddenly have a retention of urine. We call it as acute retention of urine, where one moment the urine stops flowing. So the urine accumulates in the bladder, and it causes severe distress, severe pain in the abdomen, where bladder is bursting, and patient is so restless because urine is not flowing out. So that is an emergency situation. So where we need to immediately catheterize the bladder to drain the urine out, and subsequently they will require surgery. Other emergency situation is sometimes bleeding from the prostate. The very big prostate, if it has not taken proper treatment, there is a bleeding in the from the prostate. So they will see that bloody urine, so blood in the urine. So that is an emergency. Sometimes if they're not able to reach the hospital immediately, that blood becomes a clot inside the bladder, we call it as clot retention. So that's an emergency situation. And third thing is sometimes a very bad urinary tract infection because of prostate enlargement.
One thing leading to the other.
Yeah, if he has not taken a, because infection is not so common in men compared to the women. So prostate is a one thing which can lead to infection in men.
UTI.
Yeah, due to urinary tract infection.
Mm.
So if it is very bad infection, and that infection can spread to the kidneys, and that is an also an emergency situation. These are three things we see.
Finally, doctor, the last question that I'd like to ask is, what would you like to tell some of our listeners who have been eagerly watching this entire podcast till now? Some of the takeaways for them, or any of the anecdotes that you'd like to share with them?
Harsh, the key takeaways for our audience are like they have to adopt a healthy lifestyle to overcome modifiable risk factors for prostate enlargement, and they have to be aware of these urinary symptoms. So if they notice any unusual or worrying symptom, immediately they have to consult, seek help from their physician or urologist, so that they can do evaluation and find out what is the reason for that problem. And third thing is very regular health checks, in the sense screening, regular screening for prostate health after 50 years of age is very important to identify any uh, issues with the prostate, and it can be treated in a timely manner. So these are the important takeaways. So take care of your prostate health, aware of your symptoms, and follow healthy lifestyle.
Thank you so much, doctor, for your time and for giving us so much insights about prostate enlargement. I'm sure it has been very beneficial to all our viewers today. And coming to you, my friends, so if you are someone, or if you know someone who has been dealing with all these symptoms for a while now, I highly recommend you to quickly reach out to your closest specialist and do not ignore this anymore. And that also brings us to the end of today's podcast. Stay tuned for more such episodes where we are going to be telling you more about different issues and how to deal with them, to get to know them in depth and the symptoms as well. So that's it for today. And take care of yourself. And the last thing that I'd love to say is do not ignore what your body is trying to tell you. This is your host for today, Harsh Nagpal, signing off. Thank you so much. Thank you,
Thank you.
doctor.
Thank you.